Good evening, ladies and gentlemen, and a very warm welcome to each of you to the inauguration ceremony of the annual academic sessions 2022 of the College of Community Physicians of Sri Lanka. Well, before we begin with the official proceedings, ladies and gentlemen, we'd like to remind you that we request all of you to please adhere to the COVID-19 safety precautions because we do value your health and safety. On that note, ladies and gentlemen, it's time now for us to welcome our distinguished invitees in our midst. They will now be making their way in a ceremonial procession, so may I request us all to please rise as we welcome our distinguished guests in our midst. With us our chief guest, Ms. Chio Kanda, Country Manager for Maldives and Sri Lanka World Bank. Guest of honor, Mr. Janaka Sri Chandragupta, Secretary to the Ministry of Health. We also have other dignitaries and council members making their way into the hall in a ceremonial procession. Well, ladies and gentlemen, with that, may I request you all to please remain standing for the national anthem of Sri Lanka.
Pilih kandung mana
Ladies and gentlemen, please remain standing. As is customary in our part of the world, we would like to begin with the symbolism of the divine lighting of the oil lamp. And so we would now like to invite the following dignitaries to please come forward and help us to brighten up this function. We'd like to start off with Dr. Lakshmi Somathunga, President, College of Community Physicians of Sri Lanka. She'll be joined by Chief Guest, Ms. Chio Kanda, Country Manager for Maldives and Sri Lanka World Bank. Guest of Honor, Mr. Janaka Sri Chandragupta, Secretary to the Ministry of Health. Professor Sirimal Aberratna, Orator for this evening. Professor Rohini D. Alvis Senaviratna, representing the past presidents of CCPSL. Professor Rajata Vikramasinghe, representing the Fellows of CCPSL. Dr. Nihal Abhay-Singhe, immediate past president, CCPSL. Dr. Mahendran Arnold, President-elect, CCPSL. Mrs. Loshni Piris, Additional Secretary, Admin 1. Dr. S. Sridharan, Deputy Director, General Planning, Ministry of Health. We have Professor Senaka Rajapaksa, Director, Postgraduate Institute of Medicine, University of Colombo. Dr. Alaka Singh, World Health Organization Representative to Sri Lanka. Mr. Christian Skoog, UNICEF Representative to Sri Lanka. Mr. Yamada Tetsuya, Chief Representative of JICA, Sri Lanka. Dr. Sanat Lanarol, President, Sri Lanka College of Obstetricians and Gynecologists. Dr. Sumal Namdasena, Conference Chair, Annual Academic Sessions 2022. Dr. Shiromi Madhuvage, Secretary, College of Community Physicians of Sri Lanka. I'd now like to invite the following dignitaries to please take their seats on stage. We're delighted to be joined on stage by the President of the College of Community Physicians of Sri Lanka, Dr. Lakshmi Somathunga. We will also be joined by our chief guest, Ms. Chio Kanda. Guest of honor, Mr. Janaka Sri Chandragupta. Orator for this evening, Professor Sirimal Aberratna, and the Secretary of the College of Community Physicians of Sri Lanka, Dr. Shiromi Madhuvage. Well, on that note, once again, good evening to all of you, ladies and gentlemen, and a very warm welcome to the inauguration ceremony of the annual academic sessions 2022 of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, as all of you are already aware, the College of Community Physicians of Sri Lanka, or CCPSL, is the nation's foremost professional body of public health practitioners. Its membership consists of specialists and medical officers qualified in community medicine. Working together to promote public health through a professional approach, the college is dedicated to organizing programs on community medicine for the welfare of the people, as well as increasing awareness of the subject amongst the public. The college also strives to promote fellowship with and assist persons and institutions engaged in the practice of community medicine. Now, ladies and gentlemen, this year, the College of Community Physicians of Sri Lanka is organizing its 27th annual academic sessions from the 25th to the 27th of August. These sessions, which we are inaugurating today, will provide all of you plenty of opportunity to initiate discussion as well as to share knowledge on the most cutting edge of topics related to public health. Our theme for these sessions is resilience in public health towards post-COVID era. And I'm sure you all agree that's a very apt and timely theme considering the turbulent times that we are in. Now, at our annual academic sessions, we are privileged to be joined by reputed international as well as national resource personnel who will definitely add great value to this well-thought-out academic program. So you can be assured, ladies and gentlemen, that over the course of the next 2 days, you have an extremely productive, insightful, and educational program ahead of you. On that note, ladies and gentlemen, with that introduction to the annual academic sessions, we're now delighted to welcome you all here this evening as we thank you for giving us the gift of your presence here today. And so to now officially deliver the welcome address, it's my pleasure to invite to the lectern the President of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, please put your hands together for Dr. Lakshmi Somathunga.
Ayubowan, Chief Guest Chio Kandasan, Guest of Honor Mr. Janakasri Chamdrupta, Professor Sirimal Aberratna, the orator today, the Council of the College of Community Physicians of Sri Lanka, past presidents and fellows of the college, additional secretaries and all health ministry officials, WHO representative to Sri Lanka, Dr. Alakasi, Chief Representative of JICA, Tetsuya Yamada-san, Country Representative of UNICEF to Sri Lanka, Mr. Christian Scoop, representatives of professional colleges, academia, all the invitees, ladies and gentlemen, good evening. Today, I stand before you as the 27th President of College of Community Physicians of Sri Lanka, at the occasion of inauguration of major annual event of the college. I have a pleasing task of welcoming all of you. I am honored and humbled by your presence. Our college has a great history. Started as the Society of Medical Officers of Health, established during the British colonial era on 26th November 1927. We are of the specialty of community medicine, committed to nation's health. Our commitment and contribution are reflected in the status of public health of Sri Lanka today. One of our responsibilities is to provide public health response in scientific and evidence-based manner, and we need to allow our membership and others to showcase their analytical skills in reasoning, which will be facilitated by the annual academic sessions of the college, conducted on 26th and 27th August, followed by this inauguration. Going along with the theme, Public Health Resilience towards Post-COVID Era, we have carefully selected our invitees. Each one of you represents either development partner, Ministry of Health, academia, or other stakeholder parties. We value your presence here today. Chio Kanda-san, our chief guest today, you add glamour and meaning to our event, representing a strong development partner to Sri Lanka. We welcome you with much respect. Our Secretary of Health, Mr. Janaka Sri Chandragupta is a strength to all the professional colleges. We welcome you with much gratitude. We, community physicians, look forward to making the whole country resilient, not restricted to health. Have invited orator today, Professor Sirimal Aberratna, to deliver the oration on macroeconomic resilience. It is my honor to welcome you, Professor Aberratna. Before I conclude, it's worth to look back when we mark 11 months since my induction as the president of this prestigious college. My council and I never say that stereotype response that due to COVID or due to the economic crisis, we could not do much. Instead, we say, taking the challenges, we did our best. Ladies and gentlemen, a picture is worth 1,000 words. I invite you to a flashback. Ladies and gentlemen, that was our own production by my able council members. Once again, by welcoming each one of you, I conclude my welcome speech. I thank you and wish you a pleasant evening.
Thank you very much to Dr. Lakshmi Somathunga for welcoming the audience and also for showcasing for us the various value-adding activities that have been organized by the CCPSL and have been initiated by your presidency. Well, ladies and gentlemen, our inauguration ceremony tonight is enhanced by the presence of our guest of honor, Mr. Janaka Sri Chandragupta, Secretary to the Ministry of Health. In a few minutes from now, it will be our pleasure to listen to our guest of honor address the gathering. But before that, may I please officially introduce our guest of honor to you. Mr. Janaka Sri Chandragupta is Secretary to the Ministry of Health. He's a senior officer of the Sri Lanka Administrative Service and has served at various ministries and departments, such as the Department of External Resources, the Presidential Secretariat, the Ministry of Public Administration, the Ministry of Education, and the Auditor General's Department. He held the position of Additional Secretary Development in the Ministry of Health from 2015 to 2021. Prior to his appointment as Secretary to the Ministry of Health, he was Secretary to the Ministry of Aviation and Export Zones Development. Mr. Janaka Sri Chandragupta has a bachelor's degree in business administration from the University of Sri Jayawardhanapura and a master's in business administration from the Asian Institute of Technology. Well, with that introduction, ladies and gentlemen, it's now our pleasure to invite our guest of honor to share his message with us this evening. Ladies and gentlemen, let's put our hands together for Mr. Janaka Sri Chandragupta.
Good evening, everyone. Our chief guest, Mrs. Chio Kanda, Country Manager of the World Bank of Sri Lanka, the President and the Council of the College of Community Physicians of Sri Lanka, Additional Secretaries and all Health Ministry officials, the Professor Sirimal Aberratna, and WHO representative of Sri Lanka, Chief Representative of JICA, Country Representative of UNICEF of Sri Lanka, all the invitees, ladies and gentlemen. Giving due honor the invitation, I am very pleased to be here for the inauguration of the academic sessions of this esteemed college. I am happy that President of this college is from the Ministry of Health, our Additional Secretary Public Health Services, who is Dr. Lakshmi Somathunga. I appreciate the inputs by all public health professionals whose technical input was highly useful for improving health status of our people of Sri Lanka. Also, it is well aware across the world that Sri Lanka's public health services are progressing well. I take this opportunity to thank all the public health professionals for their contribution. Also, I am very pleased to note that many public health professionals from Sri Lanka are placed at UN and other global technical organizations and work as specialists, which shows the competencies of the public health physician and their acceptance at the global level. I request you to continue the good work by all community physicians who are assessed of our health sector, and wish you all the best for the 27th academic sessions. Thank you, everyone.
Thank you very much to our guest of honor, Mr. Janaka Shri Chandragupta, for his well wishes on this occasion. Ladies and gentlemen, we are privileged that this evening we are also joined by our chief guest, Ms. Chio Kanda, who is the country manager for Maldives and Sri Lanka World Bank. We will shortly have the privilege of listening to our chief guest address the gathering, but now may I have the pleasure of officially introducing our chief guest to you. Ms. Chio Kanda is the World Bank's country manager for Maldives and Sri Lanka. A Japanese national, she has held technical and managerial positions in the World Bank and other international development institutions for nearly 30 years. In her previous role as Portfolio and Operations Manager for the Philippines Country Management Unit, Ms. Kanda was responsible for portfolio management and quality assurance of the Philippines Country Program. She also carried out similar responsibilities in the Tanzania Country Office as Deputy to the Country Director. Previously, Ms. Kanda served as Senior Economist in the Human Development Department of the Africa region. And prior to joining the World Bank, she worked as the economist for the United Nations Development Program based in Malawi. She holds an MBA and master's degrees in economics and in international development. Well, with that introduction, ladies and gentlemen, it's now our honor to listen to our chief guest this evening as she shares with us her esteemed point of view. So on that note, ladies and gentlemen, let's now put our hands together for Ms. Chio Kanda.
President of the College of Community Physicians in Sri Lanka, Dr. Somathunga. Chief of Guest, Mr. Chandragupta, Secretary of the Health Ministry. Professor Aberratna, Council members, development partners, distinguished guests, ladies and gentlemen, good evening. It is indeed a pleasure and an honor to be here as chief guest at your prestigious professional event, the inauguration of the 27th annual academic sessions of the College of Community Physicians in Sri Lanka. I learned that this college is one of the oldest professional colleges in the country, with many eminent public health professionals, and has contributed immensely to Sri Lanka's success story of the health achievements. I appreciate your continuous engagement with the Ministry of Health and development partners in pursuing broader strategic agenda towards the National Development Plan in the country. Sri Lanka has a strong track record of providing high quality and affordable healthcare services to its citizens. This has contributed to the Human Capital Index for Sri Lanka above the global average and above the average for lower middle-income countries and tops among South Asian neighbors. However, such gains built up over many years are threatened as a result of the COVID pandemic and recent economic crisis, and poverty is expected to rise. Globally, the COVID-19 crisis, the Ukraine conflict, and the growing inflationary pressures are expected to lead to an additional 75 to 95 million people in poverty this year, compared to pre-pandemic projections. Given the complexity of the dynamic relationship between health, climate change, and economic development, the region needs to rethink its development strategies to build resilience, as in the theme of the event, in national and regional systems. We need to be prepared for new disease outbreaks and other shocks that could either be climate-related or driven by economic distress. In today's context, disaster management is not only about responding to emergencies in times of disasters, it is also about anticipating and reducing risks and strengthening resilience of communities and individuals. More importantly, this process needs to ensure that the development progress is not reversed and help the communities build back better and stronger and more resilient. The World Bank Group has been taking a fast, broad, and early actions to help developing countries fight against the health, social, and economic impacts of the pandemic and other shocks. It is a pleasure indeed to note that the World Bank partnership with the government of Sri Lanka was able to support, through our health projects, the immediate response to the COVID pandemic and the recent response to the acute shortages of medicines and medical supplies. The World Bank was the first to step in and reallocate the existing portfolio in April to finance some of the essential medicines and medical supplies. Further, our ongoing investments in strengthening the primary healthcare systems and several grant-financed technical assessments on health system development would yield a sustainable impact in health system delivery mechanism in the country. The World Bank is happy to be a partner with you in your development endeavors. Sri Lanka has done well in managing the COVID pandemic while recording an impressive vaccination coverage. As high as 96% of the population of 20 years of age and above with the 2 doses. I remember when I first arrived in Sri Lanka in September 2020, I was quite impressed by well-organized, strict control measures against COVID-19 and their enforcement, including entry at the airport, strict quarantine measures, mask wearing and temperature checks, hand sanitizing at every building and establishment. I was also touched by the stories I read in the media and the photos I've seen, where the public health workers who made up tremendous efforts to reach the vulnerable populations who could not access vaccines in the extremely remote areas of the country. The country's emergency response to the pandemic was timely and effective, but stronger and more comprehensive efforts along the person's life cycle will be needed to further protect and promote human capital. The World Bank has provided about $400 million, 398 to be exact, in financing for the COVID emergency project. The project has helped strengthen the country's pandemic preparedness and response by establishing isolation units, strengthening the capacities of ICU and treatment facilities, increasing testing and diagnostic capacity, and strengthening the infection control and surveillance systems. It has also strengthened mobility support, providing cabs and motorbikes for use by medical officers of health and public health inspectors who are in charge of all grassroots level health and COVID management activities. Further, it supported social protection measures for vulnerable communities in addition to vaccine procurement and deployment. To build a better future, the emphasis must now shift from short-term emergency response to a sustainable, inclusive growth agenda. A sustainable, inclusive growth agenda will focus on growth that enables and fosters the human capital, health, and the environment while improving the livelihood of the people of Sri Lanka. We need to march toward a better future where our actions help our economies to be more resilient and secure. I'm sure the College of Community Physicians will play a major role in facilitating the national development agenda in Sri Lanka. And it starts from you, from each one of you, with your commitment and dedication to the country. I wish you every success in the deliberation at your 27th annual academic sessions. Thank you for listening.
Thank you very much to Ms. Chio Kanda for sharing with us those positive impressions about Sri Lanka's COVID-19 response and also for encouraging us to continue to be more resilient in our efforts towards public health. Well, ladies and gentlemen, we have now come to a highlight of our agenda here this evening. As you're all aware, ladies and gentlemen, our inauguration ceremony tonight consists of the prestigious College of Community Physicians of Sri Lanka Oration 2022. Ladies and gentlemen, our gathering this evening is enriched by the presence and expertise of Professor Sirimal Aberratna, who will be delivering the oration this evening. To now officially introduce our distinguished orator to you, it's my pleasure to welcome back the President of the College of Community Physicians of Sri Lanka, Dr. Lakshmi Somathunga.
Good evening again. Professor Sirimal Ashoka Aberratna had his school education from Thamagalla Vidyalaya and Bauddhaloka Piriwana in Kurunegala, and his bachelor's degree from University of Colombo. He obtained his MA and MPhil degrees from International Institute of Social Studies, The Hague, Netherlands. He is a PhD degree holder from Free University of Amsterdam, Netherlands. He has been involved in teaching economics at both undergraduate and postgraduate levels, covering a wide range of subject areas, including macroeconomics, international economics, and development policies and issues. As a researcher, he has gained experience and competence in a wide range of areas in economics, such as international trade and finance, policy reforms and liberalization, small and medium enterprises, biodiversity and economics, economic dimensions of civil conflicts, development policy issues, and the current economic affairs and issues. He has a vast experience as an academician since he started as a lecturer in economics in 1985. He has been serving as the chairman of the Monetary Policy Consultative Committee of the Central Bank of Sri Lanka for 4 years. Professor Aberratna has authored a series of publications as books, book chapters, and journal articles, while continued to be a newspaper columnist for the Sunday Times newspaper in Sri Lanka, contributing a weekly column under the title Down to Earth Economics. He is also a media economist, contributing to discussions and debates on current economic affairs in both print and electronic media in Sri Lanka. Teaching and research in the field of economics have been Professor Aberratna's profession and passion, while he enjoys impacting upon policy making as well as people's understanding on economic affairs. He prefers a pragmatic approach to convey the message in economics in simple language. He values economic freedom for prosperity and, for that matter, the rule of law in preserving economic freedom. We are honored to have you, Professor Sirimal Ashoka Aberratna, to deliver the oration of the College of Community Physicians of Sri Lanka.
Thank you, Dr. Lakshmi Somathunga, for officially introducing our orator. But before the oration, ladies and gentlemen, we will now be witnessing the awarding of the Orators Medal to Professor Sirimal Aberratna. And the Orators Medal will be awarded on behalf of the College of Community Physicians of Sri Lanka by the President, Dr. Lakshmi Somathunga. We see the Orators Medal coming right now on stage. And with that, we invite our President to officially present this Orators Medal to Professor Sirimal Aberratna. Ladies and gentlemen, can we please put our hands together as we recognize Professor Sirimal Aberratna as our orator. for the annual academic sessions 2022. And on that note, ladies and gentlemen, to now enlighten us on the topic macroeconomic resilience, why is it important? Please welcome our orator, Professor Sirimal Aberratna.
Thank you. The President of the College of Community Physicians of Sri Lanka, Dr. Somathunga. Our chief guest, Chao Kanda. Our guest of honor, Mr. Chandragupta. And distinguished guests, ladies and gentlemen. It's a privilege for me to be here today for this oration at this prestigious occasion of the College of Community Physicians of Sri Lanka for the annual oration. I consider it as an honor for me as well. So thank you for that invite, Dr. Somathunga. The topic that I'm going to speak about, macroeconomic resilience. Why is it important? There is no other time rather than this time to speak a topic as such as we have faced with an unprecedented economic crisis in this country that we ever had during the post-independent history of Sri Lanka. I don't have to specify elements of the crisis because we all know now, in fact, before the crisis, and when we were talking about we were heading towards a crisis, many asked me, what does it look like an economic crisis? So because we used to write on it, in fact, I started writing about Sri Lanka's journey towards a crisis situation, particularly foreign exchange crisis situation, as far back as 2008. And then we saw the collapse of the Greece economy. Of course, the Greece was a rich country in Western Europe. And then also we published things and have spoken about the things that are we also going in the same direction because it was a debt crisis. Then we saw Venezuelan case. Venezuela was also richer than Sri Lanka. In fact, it was one of the richest countries in that region, even in the 1980s because of oil. But it proves to be that having resources does not guarantee your resilience, your prosperity, and your progress. Perhaps it can also be, for some it can be a blessing, but for some others it can be a curse. Then we saw Lebanon and a series of number of countries falling apart because of the economic crisis. And even today, we see many countries having that problem. But however, the macroeconomic resilience in some other countries, because they have a stronger resilience, they can cope with, they can overcome, and they can recover quickly when there is a problem. It's like the immunity system in our body. I don't have to explain how it works, and you all know much better than I do about it, immunity system. And when the external threats, virus or bacteria hit our body, some people don't even feel it when the COVID virus spread. And some people ended up in fatal consequences they had to face. Why? Because of the differences in the immunity system. Macroeconomic immunity is also similar thing for a nation. We can build it up over the years, or we can destroy it even now existing macroeconomic stability over the years by doing unnecessary things, wrong things. That's why we need to look for the future. Now, economic crisis, we have seen the crisis in rich countries, which are inherent features of the economic systems. They need to get adjusted from time to time in Western Europe, in the United States, in those countries. But the crises of this type are not like that. These are man-made crises. We have made it up. How we did it? One of the important features that we can observe in economic crisis is that it builds up slowly over the years, maybe over the decades. But then the collapse is instant because it needs some triggering factors, external threats. So people might have referred to the tax cuts in 2019, or the fertilizer ban in 2020, or the COVID pandemic in 2020, and many other things as such, and corruption and all these things that people talk about. Of course, they have either been underlying triggering factors to trigger this crisis, or they have expedited the crisis. But however, the most fundamental things remain beyond those factors. What is that? In fact, we have been moving towards a crisis. The way in, I'm going to explain it to you in a little while, which I have been talking about for many years, even before the crisis, in a very simple language. And if we understand the way in, we should also understand that the way out of the crisis should also be in the same way. Now, before I start, I want to highlight a simple economists have made it complicated, but very simple theory. To understand this one, rather a hypothesis, as economists call it. To understand this, we need to know that there are two important accounts, similar to a balance sheet. Two important accounts for a nation, for a country. One is called internal finance. Other one is called external finance. External finance, as you see here, it is about the foreign exchange market. We earn foreign exchange, we spend foreign exchange. So there are foreign exchange inflows and outflows. So when we when we check about balancing these two flows, and that is coming under external finance of a country. The other one, internal finance, is, as we all call it, government's budget. It also has inflows and outflows, so incomes and expenditure, or government revenue, that is primarily tax revenue, and government spending for all the activities. So what we have seen, particularly when you look at the Asian experience, we have seen two kinds of approaches. The theory, or rather the hypothesis that I am going to refer to is called twin deficit hypothesis. Twin deficit. Twin, there should be two deficits, and the two deficits are in these two accounts, external finance and internal finance. The countries which have focused primarily on external finance as a policy approach, they have, when you look at this, the first part of that slide, you will understand they have sustained their growth, economic growth, over a long period of time, which is the fundamental requirement for our prosperity to become rich as a nation. And when you look at the outcome in terms of these two accounts, external finance accounts, we have seen the positive trade balance, improving trade balance, and also sound budgetary management, along with sustainable economic growth. Some countries have focused more on the other one, which is internal finance, which is the government budget, so that the primary characteristics of this kind of policy approach is that always we focus more on spending. Spending. You need income to spend also. Spending. And the growth originating from government spending is unsustainable because you always, every year, you have to spend more and more to sustain that growth, and you can't do that all the time. In fact, there is another reason for that. Economists know the distinction between tradable and non-tradable, the sectors. And when the government starts spending and spending and spending, it is basically expanding the non-tradable sector, which cannot sustain without the growth of the tradable sector, which is actually feeding into the external finance through exports. Now, when the countries focus more on this internal finance, the government spending, those countries, while having this unsustainable growth momentum, they also face the twin deficit, which is they will have budget deficit and growing budget deficit, which cannot be sustainable at the end, and also growing trade deficit. That's the difference between exports and imports. So trade deficit. Both deficits will be the outcome of this approach. So having said that, I'm going to refer to few numbers from last year. I'm looking at first the internal finance position, although last year was a very special year because of the crisis situation, because of the COVID pandemic, but obviously these problems have been growing over the years, growing over 10, 20 years. Our government's revenue and grant, you can see 8.7% of GDP. This is a very, very low number compared to when we put it in the context, when we compare it with other countries. In fact, Sri Lanka also started with 20% of GDP as the government revenue. But now it has come down to this level. Even before the crisis, it was somewhere around 10, 11, 12%, which is still very low. Now, recurrent expenditure is something that we need to carry out every year, sustaining our existing expenditure patterns. You can see last year it was 188% of the revenue. That means your revenue is not enough even to maintain your day-to-day lifestyle as a nation. Total expenditure, 240% of revenue. So there is nothing to talk about the total expenditure because recurrent expenditure plus capital expenditure is the total expenditure. So that we have unsustainable budget deficit, which is more than 12% of GDP. Now, tax revenue is the primary income of the government. Why do we pay taxes? Because as a people, as a nation, as people living in a civilized nation, civilized country, we need to pay taxes. Because government has a lot of important services to deliver to us for our civilized lifestyles. So that we need to pay taxes. So the tax revenue has a problem. What is the problem? Our people don't pay taxes. You can see direct taxes, so income taxes. Now in this case, 23% of the total tax revenue. In fact, sometimes I have seen it has going down to even to 20%. In fact, according to our level of development, I guess it should be 40, 50% of the total tax revenue. Because of why is it so low? Well, there are a number of reasons, but if I put all these things together, the government does not know our people's income and wealth. And we have not established any system to know that also. So when the government does not have people's income and wealth, information about this. And then the easiest way to catch people to pay taxes is when they spend. So we have 77% indirect taxes, that is the taxes that you pay when you purchase certain goods and services for yourself. So we have a complicated tax system, including that VAT and import duties and other taxes, which we have complicated over the years. Debt service payment, the government, apart from all these expenditures, the government also has to pay the principal of the borrowings plus the interest, which is the debt service. Now you can say 80% government has to pay it from out of the taxes. 80% of the tax revenue goes to pay previous borrowings, including interest payments. So how is it possible? It's like a person earning monthly income and 80% of the salary goes to pay loan installments. And the debt payment is 183% of the tax revenue in Sri Lanka, which is unsustainable. Now, when you look at the total debts, that is the first quarter, end of the first quarter of this year, the latest figures, we can see almost 22 trillion rupees. And the domestic debt is about 56% and foreign debt is about 44%, which can be translated into foreign currency, that is 51 billion. And it does not include the development bond borrowings as well as the state-owned enterprises, their borrowings. So if you include that part also, it will be even more. This is some time ago, the finance ministry had calculated how much we have to pay as foreign debt for the coming years. You can see before 2010, we were paying as debt service payment about $1 billion, foreign debt only, okay, $1 billion. But now we are paying about $4-5 billion a year on average. In fact, last year we had about, I think as I remember, more than $6 billion to pay. So then we suspended that, we are not in a position to pay it. So you can also see the averages. And if you go beyond 2010, the average would be somewhere around 1 billion. And during the first 5 years after that, 2010 to 2020, first 10 years, it's about $2 billion. And then now we have come to it's about $4 billion. Why we have that kind of foreign debt? Because of this, the big blue patch you can see, that has made us to get trapped in ISBs or international sovereign bonds, which we started borrowing from the market, international market, issuing sovereign bonds denominated in dollars. That is commercial borrowing. Started in 2007 up to 2019, when we stopped that, we had borrowed $17.5 billion. In fact, our total investment that we have accumulated for this country for the last 40 years, starting from 1980, that was 13 billion. But we have borrowed only through ISB $17.5 billion. Okay, now we understand how we have been spending more and more and more, but having a very weak tax revenue for the government. So if we understand that problem, there needs to be a correction there. And without that correction, there is no move forward. It's going to be very painful. But anyway, there should be a correction. But the most fundamental to that is, again, when you look at the external finance. External finance, again, if you look at 2021, last year, you can see we have earned $28 billion. not earn, spend 28 billion, out of which 22 as import expenditure. We need to import our all essential things, consumer goods, producer goods, and 6 billion as debt service payment. So then it makes up 28 billion. And how much we earn? We earn 18 billion only. 12.5 billion from exports, 5 billion worker remittance, and half a billion tourist income. Of course, it was about 3-4 billion before 2019, before the COVID pandemic. So that's why the triggering factors made us to collapse. So we need 10 billion more to cover up that part. And how did we manage this one before last year? Of course, we had some remittance. If you have some people prefer to increase remittance. And in fact, we have to be shameful if we are focusing on increasing remittance, because when you send your people abroad to the Middle East to work, in fact, if you make their lives harder, there will be more and more people going abroad to looking for jobs, which means your economy is not capable of giving them opportunities. So anyway, we still have about 5 billion worker remittance last year. Before that, actually, we had about even 7 billion before the pandemic problems. And even after we suspend our debt payments, still we need 4-5 billion more in order to sustain our import expenditure, more than what we earn. But we continue to manage this one. How? Because of the rising tourism income, because before the 2009, before the end of the war, our tourist arrivals were about less than half a million during the wartime. But as the war was ended, there has been a sharp increase in tourist arrivals, even exceeding 2 million. So with that, we were very comfortable receiving tourism income, number one, receiving foreign remittance, number two. And whenever these things are not enough, then we used to borrow and then cover up our deficit. And whenever it is also not enough, particularly during the pandemic period, and then the central bank has a stock of savings called foreign exchange reserves, we used to stop that also to pay for our debt, to pay for our foreign exchange shortages, to manage the exchange rate. And then we also borrowed bilateral and multilateral sources some money. And with all these things, we managed so far. So, where to turn now? Nobody is going to give us all the time the lend money. Okay, you spend for your fuel and gas and medicine and food, and you continue to consume, but without earning. That is where we are right now. In fact, you have seen yesterday also there was a list of imports came under import control. So this is a simple illustration of things, the graphs as well as the table, which I have shown so many years now. I have been extending it. You can see the right-hand side graph, the brown line. Our export income as a percentage of the government revenue, which has been falling steadily. And the yellow line is that includes service income also. You can see it has an upward trend after 2010. That is because of the tourism income. Otherwise, this kind of steady decline cannot be sustained that long. In fact, more than half, it was earlier close to 35% of GDP. Now it is less than 15% of GDP. If you look at our export growth, and I would ask you to compare Sri Lanka with Vietnam. About 25 years ago, we were exporting almost similar amount, $4-5 billion. But 25 years later, today, or last year, 2020, Sri Lanka was exporting 10 billion worth export, whereas Vietnam 283. In fact, the countries which were much poorer than Sri Lanka, like Myanmar and Cambodia, you can look at how much they have exported or earned foreign exchange through exports during the last 20 years. Bangladesh. In fact, we borrowed from Bangladesh also, if you remember. Now, import controls, is that a solution for the crisis? No. Why not? Because it creates spiral effects. 80% of our imports are to sustain our production, including exports, because they are intermediate inputs and capital goods needed in business activities to produce something, either good or a service. So when we cut down that imports, what will happen? Our production will not be sustained, people lose incomes and jobs, and poverty start rising. In fact, the UNICEF a few months ago released a report saying that 5.5 million people in this country are starving. That is a quarter of our population, almost. Quarter of our population. And the most vulnerable are those children. In fact, they have cut down their daily number of meals and the quality of the meal that they take. So the UNICEF, UN agencies, they are asking humanitarian assistance from the rest of the world. That is the result of the crisis. Exports. And if we need dollars, we can't print dollars like rupees. We have to earn dollars. And how do we earn? The main source of dollar earnings is export. And we are cutting down exports by controlling imports. And I saw in the list and chocolates and water and various kind of what we call luxury items. In fact, water, well, I have heard from many people, Sri Lanka imports water from France, that Perrier water. Small bottle is 400-500 rupees, and in some of those supermarkets you can buy those. I don't know whether it is available now. Why Sri Lanka import water? Because if we are looking for quality tourists who like to spend $1,000, $10,000, $15,000 a day, those tourists, if we are looking for those kind of high spending tourists, we need to import water. If they ask for water, they will not bring it by themselves. When you go to South Africa, you know that you keep a water can in your vehicle to go to South if you will have doubts about getting water there. But tourists don't do that. And they need their food, they need their comfort here. If we cannot treat them, you don't expect high spending tourists. So, spiral effects of crisis. Why we need to cut down imports? Because we cannot sustain it. And we were comfortable because we have seen the fuel lines getting shorter and gas available now, and all these things on borrowings. And what will come after the borrowing? Next month or towards the end of the year, by the beginning of next year. In fact, we are expecting a couple of things. I don't say that we shouldn't. One is tourism revival. I would say, okay, yes, by the end of this year. Another one is the IMF staff agreement and that program, OES. I subscribe to that as well. But what we have done, what have we done? What is our fundamental problem? We need to shift our policy focus to earn foreign exchange and on this side, cutting down those unnecessary expenses. To that end, what we have done remains a question so far. If we understand the way in, it should be the way out also. So I'm going to just summarize 3 levels of reform that Sri Lanka needs. For my understanding, the number 1 is our export growth. Export growth. Why exports have been falling as a percentage of GDP and why it has been falling among all our neighboring countries, we need to address that question. That requires investment. Why investment is not taking place in this country? There is something important there. Although we say, Loken utum rata Sri Lanka, but investors don't see it in that way. They don't want to put their money in. Why? We need to address that problem. So those are not overnight policies. Of course, it takes time, but there are low-hanging fruits. I have no time to explain where and how we should plug these low-hanging fruits at the moment. But that is number 1. Number 2, it needs macroeconomic support by correcting our government budget, income side and expenditure side. Income side does not need, in fact, raising tax rate. Our tax rates are already high. What we need is to broaden the tax base because majority of our people don't pay taxes. And some of the people, they are exempted from taxes. Only very few people pay income tax. Government revenue side. Spending side, a lot of cutting down has to be done. And there are various things. Fiscal Responsibility Act, which we have put aside for the last 10 years, we need to bring it back. And cutting down expenditure from top to bottom, that is nothing. And liberalizing fuel, electricity, gas supply, bringing more price. I'm happy that the government is taking steps in these directions. And other state-owned enterprises, they need to be reformed because we cannot sustain anymore. And targeted poverty alleviation. So all these are necessary steps, and the central bank should confine to its primary objective, that is maintaining price stability. Last, the short-term one, of course, all these current programs that are in place, they are short-term. But we should have them, without which actually I don't know what is going to happen within the next couple of months. Nobody knows. And when the problem comes, we cut down further imports, and which will have spiral effects, controlling our production base and putting us in more and more troubles. But to avoid that part, we need to have that short-term programs, debt restructuring and IMF staff agreement and all these things. But I'm sure that the major part, that is foreign exchange earning, export growth, investment growth, that has to be worked out by ourselves. Thank you very much.
Thank you very much to Professor Sirimal Aberratna for giving us the gift of his experience and expertise and providing us such a thought-provoking presentation on macroeconomic resilience and why it is so important for Sri Lanka. Ladies and gentlemen, we have now come to a special part of our agenda this evening, which is the awarding of fellowships. At the College of Community Physicians of Sri Lanka, the Council from time to time admits distinguished persons of the college as fellows in recognition of their exceptional service to public health. This award of fellowship is a prestigious accolade indeed, and it's my pleasure now to announce the respected and renowned senior members of the profession to whom this fellowship is conferred upon today. We're now about to individually introduce and recognize each of our fellows, and as I read out the names of the recipients, I'd also like to request the member reading out their citation to now join us on stage. Our first member to receive the fellowship is Professor Samat Dharmaratna, and to read out his citation, I'd like to invite Dr. Ruan Vijayamuni.
Thank you. I'm privileged and deeply honored to introduce Professor Samat Damida Dharmaratna for the fellowship of the prestigious College of Community Physicians of Sri Lanka. Professor Samat Damida Dharmaratna obtained his postgraduate degrees of MSc and MD in Community Medicine from the Postgraduate Institute of Medicine, University of Colombo in 1997 and 2002. Professor Dharmaratna joined the Department of Community Medicine, Faculty of Medicine, University of Aberratna in 1994 and has been teaching at the faculties of Medicine, Dental Sciences, Arts, Science, and Allied Health Sciences at the Universities of Aberratna and at Postgraduate Institute of Medicine, University of Colombo. At present, he is the Chair Professor, Department of Community Medicine, Faculty of Medicine, University of Aberratna. He was a member of the Board of Studies in Community Medicine, Medical Administration, Multidisciplinary Study Courses, and Sports Medicine at the PGIM, Colombo, and was a member of the Board of Management of the PGIM. He was a former chairperson of the Board of Study in Community Medicine and a former secretary in the Specialty Board in Emergency Medicine at the PGIM. He was also a former secretary and a board member of the Board of Study in Zoological Sciences at the Postgraduate Institute of Science, University of Aberratna. Professor Dharmaratna has over 128,000 Google Scholar citations, an itch index of 67, and I-10 index of 113 to date. He has supervised 46 postgraduate students and delivered Bibli Memorial Oration and the Candy Health Research Prize Oration. He has received many national and international awards, including 8 presidential awards for scientific publications, 2 National Research Council Merit Awards, Award of Excellence in Health Emergency Management, Australian Leadership Awards Fellowship, and Australia Awards Fellowship. He has ongoing collaborations with the Universities of Washington, Kentucky, Johns Hopkins, Yale, Connecticut, and the California University of Science and Medicine in the United States of America. Professor Dharmaratna is the president of the Sri Lanka Medical Association and was a council member of the SLMA continuously for the past 11 years. Professor Dharmaratna was a past president, joint secretary, and a council member of the Candy Society of Medicine. He is a life member of the College of Community Physicians of Sri Lanka since 1997 and served as a council member for the year 2006-2007. Madam President, considering the great contributions made to the field of public health, I present to you Professor Samat Damida Dharmaratna for the conferment of the Fellowship of the College of Community Physicians of Sri Lanka for the year 2022.
May I now request the President of CCPSL, Dr. Lakshmi Somathunga, accompanied by the Secretary of the College of Community Physicians of Sri Lanka, Dr. Shiromi Madhuge, to now confer the fellowship on Professor Samat Dharmaratna. Ladies and gentlemen, can we please put our hands together as we congratulate Professor Samat Dharmaratna as a Fellow of the College of Community Physicians of Sri Lanka. A loud round of applause, ladies and gentlemen, once again to Professor Samat Dharmaratna. Ladies and gentlemen, our next member to receive the fellowship is Dr. Dhammika Rowell. To read out the citation of Dr. Dhammika Rowell, I'd like to invite on stage Dr. Himali Herath.
Thank you. I'm privileged and deeply honored to introduce Dr. Dhammika Rowell for the fellowship of the prestigious College of Community Physicians of Sri Lanka. Dr. Dhammika Rowell is a consultant community physician currently working at the UNICEF Country Office, Sri Lanka. She obtained her MBBS from the Faculty of Medicine, University of Colombo, and started her public health career as a medical officer of health in Chilau. Dr. Dhammika Rowell obtained her postgraduate degrees of MSc and MD in community medicine from the Postgraduate Institute of Medicine, University of Colombo. As the National Program Manager of Intranatal and Newborn Care at the Family Health Bureau from 2007 to 2018, she co-edited 2 consecutive National Maternal and Newborn Health Strategic Plans and the Every Newborn Action Plan 2017-2020. The Edinburgh Postnatal Depression Scale, which she validated locally and published in the CMJ, is the national screening tool for postpartum depression. Dr. Rowell was commended the Blueprint on Program Implementation for her work in SARC development project to improve newborn services, and she made her mark in strengthening breastfeeding nationally and globally. She was the president of the Perinatal Society of Sri Lanka in 2014 and the honorary treasurer of the College of Community Physicians of Sri Lanka in 2014-2015. In the year 2019, Dr. Rowell delivered Dr. F.A. Wickramasinghe Oration of the College of Community Physicians of Sri Lanka. Madam President, considering the great contributions made to the field of public health, I present to you Dr. Dhammika Rowell for the conferment of the Fellowship of the College of Community Physicians of Sri Lanka for the year 2022. Thank you.
We now request our President, Dr. Lakshmi Somathunga, and the Secretary, Dr. Shiromi Madhuvage, to now confer the fellowship on Dr. Dhammika Rowell. Ladies and gentlemen, here we have the fellowship being awarded by our President. Let's put our hands together, ladies and gentlemen, for Dr. Dhammika Rowell. Congratulations on being conferred a fellowship by the College of Community Physicians of Sri Lanka. Our next member to receive the fellowship is Dr. Nimalka Pannilahetti. To now read out the citation of Dr. Nimalka, I'd like to invite on stage Dr. Ishanka Talagala.
I'm privileged and deeply honored to introduce Dr. Nimalka Pannilahetti for the fellowship of the prestigious College of Community Physicians of Sri Lanka. Dr. Nimalka Pannilahetti, having obtained the degree of Bachelor of Medicine, Bachelor of Surgery from the Faculty of Medicine, University of Colombo, completed her master's degree in community medicine in the year 1996 and MD in community medicine in the year 2003, followed by her postdoctoral attachment at the Department of Public Health, Monash University, Australia. Her public health experience spans over 25 years, having worked in different vector-borne disease control programs and the epidemiology unit until she joined the National Dengue Control Unit, Ministry of Health. As the longest served medical professional attached to the National Dengue Control Unit, she held the post of the coordinator and was instrumental in formulating various policies and strategic plans on dengue prevention and control. She served as the abstract committee chair of the International Research Symposium Dengue Amidst the Pandemic, which was held in March 2022. While it is not surprising for her mere dedication to create multiple works from a single location, Dr. Panilaheti was one of the originators who painted the landscape of National Dengue Control Unit to its current position. She is serving as a committee member of the Social Subcommittee of the College of Community Physicians of Sri Lanka as well. Madam President, considering the great contribution made to the field of public health, I present to you Dr. Nimalka Panilaheti for the conferment of the Fellowship of the College of Community Physicians of Sri Lanka for the year 2022.
We now request our President, Dr. Lakshmi Somathunga, as well as our Secretary, Dr. Shiromi Madoge, to now officially confer the fellowship on Dr. Nimalka Panilaheti. Ladies and gentlemen, can we please put our hands together as we recognize Dr. Nimalka Panilaheti as a fellow officially conferred by College of Community Physicians of Sri Lanka. Ladies and gentlemen, our final member to receive the fellowship this evening is Dr. Ruan Vijayamuni. And to now read out the citation of Dr. Ruan Vijayamuni, I'd like to invite on stage Dr. Deepika Artigala.
Good evening to all of you. I'm privileged and deeply honored to get this invitation to introduce Dr. Ruan Vijayamuni for the fellowship of the prestigious College of Community Physicians of Sri Lanka. Dr. Ruan Vijayamuni started his academic career from the D.S. Senanayake College, Colombo. He has obtained a full government scholarship from the Ministry of Higher Education to study medicine at the State Medical University of the USSR. After obtaining his Doctor of Medicine degree, he opted for public health and joined the Colombo Municipal Council as a MOH. He obtained his master's degree in public health from the University of Leeds, UK, and his master's degree in community medicine from the Postgraduate Institute of Medicine, University of Colombo. In 2014, Dr. Vijay Muni was appointed to the post of Chief Medical Officer of the City of Colombo. During the COVID-19 pandemic, he led his public health team very professionally and efficiently in controlling the disease spread and minimizing the COVID-attributed deaths within the Colombo municipality area. He dedicated 34 years of his life to public health, contributed immensely to the fields of air quality management, sanitation, noise pollution mitigation, food hygiene, transport medicine, and also to road safety as the chairman of the National Transport Medical Institute. He accomplished many prestigious awards such as U.S. Environmental Achievement Award, Nirmana Shrama Abhimani National Award, National Productivity Award, and Presidential Award for Scientific Publications. On a personal note, I'm extremely privileged to read this citation to a true gentleman, a professional with very positive and friendly attitude, with whom I have associated for many long years, including accomplishing our first academic milestone in public health, Masters in Community Medicine, together in mid-90s. Madam President, considering the great contributions made to the field of public health, I present to you Dr. Ruan Vijayamuni for the conferment of the fellowship of the College of Community Physicians of Sri Lanka for the year 2022. Dr. Vijay Muni.
We now request our President, Dr. Lakshmi Somathunga, accompanied by our Secretary, Dr. Shiromi Madhuvage, to now officially confer the fellowship on Dr. Ruan Vijayamuni. Let's put our hands together, ladies and gentlemen, for Dr. Ruan Vijayamuni. Congratulations on being conferred a fellowship by the College of Community Physicians of Sri Lanka. Well, with that, ladies and gentlemen, we've now come to the conclusion of the awarding of fellowships, and congratulations once again to each of the respected and acclaimed individuals who have been conferred this exceptional honor. We appreciate your significant contribution and service in the field of public health. Now, before we move on, ladies and gentlemen, we're happy to share with all of you that our proceedings here tonight are being live streamed on the CCPSL Facebook page as well as on the YouTube channel. So we'd like to take a moment to acknowledge everybody who's watching us online, and we thank you for tuning in to our proceedings of the inauguration. Up next, ladies and gentlemen, it's now time for us to recognize and appreciate the recipients for the best results in community medicine for the qualifications of MSc and MD, respectively. As you will agree, ladies and gentlemen, this is a noteworthy and significant accomplishment, and we would now like to take the time to honor the hard work and the dedication of these two high achievers who will join us on stage very shortly. The recipient of the best result in community medicine for the qualification of MSc is Dr. Aruni Oshadi Polvatta Gallage. Let's put our hands together for her as we invite her up on stage. Congratulations to you, Dr. Aruni. I'd now like to invite our President, Dr. Lakshmi Somathunga, as well as the Secretary, Dr. Shiromi Madhuvage, to now join us in presenting the award for Best Result in Community Medicine in MSc to Dr. Aruni Oshadi Polvatta Gallage. There we have it, ladies and gentlemen, the Best Results Award right there. Congratulations to you, Dr. Aruni Gallage. And now, ladies and gentlemen, the recipient for the best result in community medicine for the qualification of MD. And the best result is that of Dr. Nadishani Bhuvanika Valpita. Let's put our hands together as we invite Dr. Nadishani to join us up. Once again, I'd like to invite our President, Dr. Lakshmi Somathunga, accompanied by Secretary Dr. Shiromi Madhuvage, to now present the award to Dr. Nadishani Bhuvanika Valpita in recognition of this accomplishment. Let's put our hands together as we congratulate Dr. Nadishani Bhuvanika Valpita. With that, ladies and gentlemen, we're almost drawing close to the end of our formal proceedings here this evening. But before we wrap up and before we move on to dinner and fellowship, let's remember to take a moment to recognize all of the many individuals who've contributed towards making this a significant and special evening. So we'd now like to officially offer each one of our contributors our heartfelt gratitude. To sum up all of our appreciation in a vote of thanks, please join me in welcoming the Secretary of the College of Community Physicians of Sri Lanka. Let's put our hands together for Dr. Shiromi Madhuvage.
Thank you, Ms. Krishma, for your kind introduction. Good evening, Madam President. Orator tonight, Professor Sirimal Aberratna, Council members, past presidents, fellows of the College of Community Physicians of Sri Lanka, our chief guest, Ms. Chiokanda, World Bank representative to Sri Lanka and Maldives. Guest of honor, Mr. Janaka Sri Chandragupta, Secretary, Ministry of Health, and all the officials from the Ministry of Health, other ministries, UN agencies, academia, professional colleges, ladies and gentlemen. I am deeply honored to deliver the vote of thanks at the inaugural ceremony of the 27th Annual Academic Sessions of the College of Community Physicians of Sri Lanka. orator tonight, Dr. Sirimal Aberratna. Thank you, sir, for accepting our invitation and delivering the College of Community Physicians Oration 2022. Madam President, Council members, past presidents, fellows of the College of Community Physicians of Sri Lanka, thank you very much for being the pillar of strength to us continuously. Our chief guest tonight, Ms. Chio Kanda, World Bank representative to Sri Lanka and Maldives. Guest of honor, Mr. Janaka Sri Chandragupta, Secretary to the Ministry of Health. Thank you for being with us today to grace the occasion. Officials from Ministry of Health, other ministries, UN representatives, representatives from professional colleges, academia, your presence today is highly appreciated. Let me pay my gratitude to all my colleagues, conference, and all the postgraduate trainees for their immense support. A special word of appreciation to Dr. Rangana Vadugedara and Dr. Maya Kadua for supporting us to make the event success. Mr. Angelo Ravindran, our college assistant. Thank you, Angelo, for your help, continuous support, and helping to us. Mrs. Krishma Pinto, we highly value your contribution in comparing this event. Let me take this opportunity to extend our gratitude to family members of late Dr. HMSSD Herath and family members of late Dr. N.W. Vidyasagara to be with us to grace the occasion. President and the Council would like to extend our heartfelt gratitude to all of you who joined with us physically, virtually, to witness this event. Let me invite you all for the reception and wish you a very pleasant evening. Thank you.
Thank you very much to Dr. Shiromi Madhuage for those very warm words of gratitude extended to everybody involved in making today a memorable event. With that, ladies and gentlemen, we now draw to a close the inaugural